Physical distancing is the best way to stop the spread of COVID-19, but wearing a non-medical mask or face covering has some benefits. Around the world, people are making their own face coverings to wear when they're in stores or anywhere else they may possibly come into contact with people. Wearing a non-medical covering isn't to protect yourself from COVID, though. It's to protect others from you. When you sneeze or cough or even speak, tiny drops of water called droplets come out of your mouth and nose. The covering holds those droplets in, so they don't get shared with people around you. Wearing a covering is a good thing for keeping your community safe. If you have a face covering on, it can also be a great reminder to not touch your face when you're out. But it comes with potential risks too, because wearing a covering can make us feel like we're more protected than we really are. Remember, a face covering or mask doesn't make it safe to hang out with people outside the home or to be with others for anything other than the essentials. And coverings can feel awkward and uncomfortable, and that can be dangerous if you're touching your mask to adjust it or to remove and replace it, for example, to talk to people when you're out for essential errands. That means you're touching your face so much more than you would without a covering on. That's risky, and so you need to be super aware of it and very careful. If you want to make your own face mask or covering, we have some great videos showing how easy it is at our government website. Once you've made your covering, here are some tips to use it as safely as possible. Wash your hands before putting your covering or mask on. You should put your covering on and remove it when you're done using the elastics or ties that go around your ears or the back of your head. Don't touch your covering to adjust it or remove it while you're out of the house. Once it's on, let it be. If you need to remove your covering while you're out, place it in a plastic bag to be brought home later. Use a new covering each time. Don't remove it and put it back on without cleaning it first. When you're done with the covering, it will need to be washed. It can go in your regular laundry, but make sure you wash with hot water. And finally, after removing your covering, make sure to wash your hands with soap and water for at least 20 seconds. Be safe out there. Masicho for doing your part. In the Northwest Territories, people are being encouraged to go out on the land as a way to help with physical distancing. This is different from some other parts of Canada, where people are being told not to go to their cabins or cottages. But that doesn't make sense here. Being on the land is our way of life. The land is a big part of health and wellness for all of us, and this is such a big territory that it's easy for us to keep safe physical distance from other families while we're out. For healthy people who enjoy the land, this is a great time to head to your camps. It will help to keep your family and your community safe. If you're planning to head out with your family, here are a few things to keep in mind. The rules around physical distancing are the same on the land as they are at home. This means you should only be with people who live at home with you. No sharing tents or cabins with other friends or family members. You need to keep 2 meters between you and people you don't live with at all times. Many of us are used to having an elder or a knowledge holder with us when we're out on the land. If this person doesn't live at home with you, they shouldn't go out with you this time. That's important to keep you and them safe from the spread of COVID-19. So think carefully about your own experience on the land and make plans based on your level of comfort and expertise. If you're not used to going out without help from others, call an elder or knowledge holder and see what advice they have for you. Start with shorter trips and stay closer to town just in case you have any issues. Before you go out on the land, tell someone your plans, where you're planning to camp, who's going with you, and when you plan to come back. Take a satellite phone or a GPS messaging device with you if you can. Remember, going out on the land is not recommended for everyone. If you have any symptoms of COVID-19, or if you've been in contact with someone who has symptoms, if a healthcare provider has told you to self-isolate, or if you've traveled in the last 14 days, you need to stay at home and self-isolate there. If you're out on the land, head back to town if you start to feel sick or show COVID-19 symptoms, such as a fever, a new cough or a cough that's getting worse, or any trouble breathing. You're better to be closer to care, just in case your symptoms get worse. Be safe, respect the land, and remember to harvest responsibly. Thanks for doing your part to help stop the spread. Hey, special shout out to everyone that's come back to the Northwest Territories and completed their mandatory self-isolation. Thank you for doing your part to slow the spread of COVID-19. So now what? Well, if you don't have any symptoms, it's okay to leave home for essential things like grocery shopping or going to work. Maintain a 2-meter distance from other people and cover your nose and mouth when you sneeze or cough. You can wear a mask or a cloth face covering too. It's okay to spend time outside, also keeping a 2-meter distance from anyone you don't live with while you're out there. Basically, act like you already have the virus and you don't want to pass it on to anyone else. Wash your hands with soap regularly for at least 20 seconds and immediately when coming back into your house. You can also use hand sanitizer if you can't get to a sink. If you have any symptoms, even mild symptoms, call your healthcare provider. That means you should call if you have a fever, a new cough or a cough that's getting worse, or if you're having any shortness of breath. Public health staff will do an assessment over the phone and will let you know if you need to be tested. You can also use the online assessment tool to help you determine if you should call. And anyone who's experiencing severe symptoms should call 911. It's good to have you home. Welcome back, and keep your distance.